Welcome to my channel. Today we're talking about alcohol and substance abuse. This is part 2 and all my questions and answers are taken directly from RN NCLEX examinations. Please hit the like button, please subscribe, and please share this video. 3 days after surgery, client begins to display signs and symptoms of tremors, increased blood pressure, diaphoresis. What should the nurse expect? The correct answer is withdrawal from alcohol from CNS depression 2 to 3 days after presentation. Three days after surgery, client begins to display tremors, elevated blood pressure, diaphoresis. These are signs and symptoms of withdrawal symptoms is the correct answer. Signs and symptoms of CNS, central nervous system, depression 3 days after is the correct answer. My next question is, newly admitted client, history of alcoholism, complain of burning and tingling sensations of the feet. Nurse should recognize symptoms of what? The correct answer, these are symptoms of peripheral neuropathy. Burning and tingling sensation of the feet are signs and symptoms of peripheral neuropathy. Next question, client diagnosed with Wernicke-Korsakoff syndrome. Which defense client diagnosed with Wernicke-Korsakoff syndrome uses which defense mechanism to fill in missing recent memories? Purpose is to maintain self-esteem. What is your correct answer? The correct answer is confabulation. Client with Wernicke-Korsakoff syndrome, self-defense mechanism to fill in missing memories is using confabulation. Purpose is to maintain self-esteem is the correct answer. Client with a long history of alcohol dependence admitted with frank hemoptysis. This is a life-threatening complication of alcoholism and the cause is, excuse me please, the correct answer for frank hemoptysis of alcoholics are hemorrhage of esophageal variances resulting from portal hypertension. Veins in the esophagus becomes distended because of pressure from defective blood flow through cirrhotic liver cirrhosis causing portal hypertension. So your correct answer is hemorrhage of esophageal variances causes frank hemoptysis. This is a life-threatening complication of alcoholics. Next question. What are symptoms that supports pancreatitis for clients with alcoholism? The correct answer is constant severe epigastric pain, nausea and vomiting, abdominal distension occurs 1 to 2 days after binging of excessive alcohol consumption. Signs and symptoms of pancreatitis: constant severe epigastric pain, nausea and vomiting, abdominal distension occurs 1 to 2 days after binging. Our next question, Which substance stimulates the CNS, central nervous system? Substance, correct answer is crack cocaine. Most potent stimulant stimulates the CNS, central nervous system. Next question. What substance produces least significant stimulation in the CNS, central nervous system? Substance least significant is tequila. Is distilled liquor. Is the correct answer. My next question. Which is the following effective ways to identify a substance abuse client? Excuse me. Which of the following effective ways to identify a substance impaired nurse? This nurse is the patient. Which is the following effective ways to identify a substance impaired nurse? The correct answer, nurse frequently administer medications to another client. Nurse has high absenteeism if substance is outside of the workplace. Nurse denies substance abuse. There's a high incidence of incorrect narcotic counts. Poor concentration and difficulty meeting deadlines are effective ways to identify a nurse who is substance impaired. The next question, alcohol is consumed at what percentage and is absorbed into the bloodstream through which body organ? The correct answer is 20% is absorbed through the stomach wall immediately. 20% of alcohol is consumed through the stomach wall immediately. The next question, rapid absorption of alcohol is influenced by. Rapid absorption of alcohol is influenced by absorption delays when drink is supposed. Absorption delayed when drink is sipped rather than gulped. Rapid absorption of alcohol is influenced by absorption is delayed when drink is sipped rather than gulped. 2. Delayed when stomach contains food rather than empty. 3. Alcohol delayed drink is wine or beer rather than distilled alcohol. Delayed drink is wine or beer rather than distilled alcohol. Absorption is delayed when drink is sipped rather than gulped. Is delayed when the stomach contains food rather than empty. Delayed drink is wine or beer rather than alcohol. These are your correct answer. Which behavior reflects the pre-alcoholic phase of progression? Which behavior reflects the pre-alcoholic phase of progression? The correct answer is alcohol is used to relieve stressful situation to relieve everyday stress and tension. This behavior is the pre-alcoholic phase of progression. There are 4 phases of alcoholism. What are the 4 phases? Is the question. We have the pre-alcoholic phase is the first one, and this is the one we said alcohol is used to relieve stressful situations, to relieve everyday tensions. The second phase is early alcoholic phase. The third phase is crucial phase, and the fourth phase is chronic phase. Next question. Client is admitted to inpatient diagnosed with substance abuse. Client lost family. Client lost his job. Client lost his driver's license. What phase of drinking pattern progression is client experiencing? We said there are 4 phases. The pre-alcoholic phase, the early phase is the second phase, the crucial phase is the third phase, and the fourth phase is the chronic phase. Which phase is this patient in? He has lost his job, he has lost his driver's license, and we need to know what phase of drinking pattern is this client experiencing, and the correct answer, this client is in the crucial phase. Client focus is total alcohol. He lose everything that was once important. The patient is in the crucial phase. He has lost everything to him that was important. The next question, the early phase of alcoholism, nurse expect to note what in the early phase of alcoholism, and the correct answer is blackouts. What are blackouts? They are brief periods of amnesia that occurs during or immediately after drinking. Next question is, which sociocultural factor increases clients' risk for alcoholism? Which sociocultural factors increases client risk of alcoholism? The correct answer, clients raised in homes of alcohol. Clients raised in homes, alcohol use is norm. Parents are alcoholics. Family culture accepts use of alcohol. Client experience pleasure when using and continue to repeat this use over and over again. These are sociocultural factors that increases clients' risk of alcoholism. The next question, which statement describes the personality factors predisposes the client to substance abuse? Which statement describes the personality factors predisposes the client to substance abuse? And the correct answer is a tendency towards addictive behavior increases as low self-esteem, passivity, and an inability to relax or defer gratification increases. What statement decreases the personality factors predisposes the client to substance abuse? The correct answer is a tendency towards addictive behavior increases as low self-esteem, passivity, an inability to relax or defer gratification increases. My next question is, client diagnosed with substance abuse says, my wife causes me to use drugs. The client is using which defense mechanism? And the correct answer is projection. Client attributes feelings or impulse unacceptable to another person. Projection is the correct answer. He says his wife causes him to do drugs. The correct answer is projection is this defense mechanism the client is using. Client attributes feelings or impulses unacceptable to another person is the correct answer. Another question for you. Client diagnosed with cocaine abuse says, this is nothing but a very small amount of ingestion. Which defense mechanism is the patient using? This defense mechanism is that of denial. Client refuses to acknowledge the existence of a real situation or feelings associated with the client. Our next question. Client recently relapsed from alcohol abstinence, seen in outpatient mental health clinic. Client say, I do not know what all the fuss is about. Which nursing diagnosis implies to this patient? And the correct answer is ineffective denial. My next question, which assessment data would nurse gather to confirm diagnosis of alcohol dependence? The correct answer is a need for increased amounts of alcohol to achieve a desired effect. Which assessment data should a nurse gather to confirm diagnosis of alcohol dependence? Your answer is a need for markedly increased amounts of alcohol to achieve the desired effect is the correct answer. Our next question is, client intoxicated with alcohol is admitted to the ED. He says, how did I get here? Which is client most likely experiencing? And the correct answer is a blackout is the correct answer, which is a blackout is periods of amnesia, brief periods of amnesia. The client does not remember how he got to the emergency room. Please hit the like button. Please subscribe. Please share this video. Thanks for watching. Have a good